Voices of Inclusive Research podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. And today you will hear the voice of Nicholas Jackson. Nick is an Inglewood, California native, healthcare advocate, and founder of iHealth Network, a multicultural health media and engagement platform focused on building trust in communities where healthcare has historically fallen short. After losing both his mother and grandmother within 6 months to cancer and dementia, Nick dedicated his career to advancing health equity, early disease detection, and clinical trial diversity. For the past 5 years, he's worked in the pharmaceutical and healthcare industry, focusing on clinical community engagement and health advocacy. In 2025, Nick was nominated for Pharmaceutical Marketer of the Year by Fierce Pharma. iHealth Network is currently in beta and preparing for an official launch. So I'm so excited to have Nick here today. Let's get started. Nick, how are you doing?
Hey, Dr. Ren. Hey, first off, thank you for the intro. Wow, that was cool. I'm doing great. It's another day, another dollar, another day in paradise. How are you?
Another day in paradise. Paradise. Are you talking about Southern California?
It's paradise to me.
Yes,
Anywhere I'm
guys.
at is paradise.
Yes, we're in Southern California, and yes, I agree with you. A new day in Southern California, hey, it could be paradise if you want it to be. Okay, well, Nick, thank you so much for being here. Tell us more about you and, get into to iHealth Network. Let us know where that passion comes from for this new venture that you're doing. I'm super excited to hear more about it.
Definitely. I think the passion to start off about, where the passion lies in 2020 was a really crazy year of my life. My mother was diagnosed with cancer, and obviously this is through, the COVID period as well too. So diagnosed with cancer, and I had to take care of my mother while she was passing away. And that was a whole thing of watching her kind of fade away and having to know when that was gonna, finally be put to sleep in that case and all that. And then shortly after, 6 months later, my grandmother passes away. And I was raised by those two women. My life changed tremendously from there. I was 24 at the time, but I still felt like I was a kid because I had my people with me. Like they always.
That was young, Nick. That's young.
Yeah. Still young. But yeah, those are the people that took care of me. Obviously, they did everything for me. So I had become a real man, I felt like pretty early. My mother passed away from a cancer diagnosis. My grandmother had a really bad case of dementia. One thing I learned from both cases, is that these are two things that we could have prevented a long time ago, right? And like on the dementia, both ends, honestly, we're not saying that, hey, we could have stopped dementia tomorrow, or like we could have stopped the cancer from spreading. It's just like, these are things we should have caught a very long time ago and, slowed these processes down, right? My mom didn't have to suffer the way she did in, her last few months of living, right? And it was just simple. Like I found that out and it's like, damn, like, why couldn't like I have done more when back then, right? I know a lot more now, and like I'm 30 now, so 30-year-old me can help, but 24-year-old me, I didn't know much. So yeah, that's kind of where the antithesis of iHealth Network comes from, is being a Black male for my community, and for other, minority communities that kind of have these same issues that, I've seen in my community. I want to be the person, I want my company to be the place that you get the information that you need so you can learn about all these different disease states, what might be affecting you, what kind of treatments are out there, if it's a medicine, if it's a clinical trial, if it's a treatment plan, if it's holistic health, any of that, you can come to us and we can help you get cured. And even to go further on that, there was a study, I forgot which health institution it was, but you know that Black people, and this other races are combining this too, but Black people in particular have a 7-year less life expectancy than counterparts.
Wow. Isn't that crazy?
Right. So these are
We have to close that gap for sure.
Yeah. So when I feel like I've won with iHealth Network is when they do the study again and that gap is closed. So that's when I feel like I won. So that's what we're fighting for. So yeah, that's
exactly. Okay, so tell us about, kind of break down iHealth Network for us, like, because it's a media company. So exactly how is this going to help close that gap?
Right. So yeah, iHealth Network is a parent media company. So it's the parent brand, and we do exclusive healthcare messaging, marketing, X, Y, and Z. Everything is healthcare, right? So the reason why we're different compared to most is that when you see like most like there are other healthcare media brands, we know that. Cool. Most healthcare media brands, they have just a website or they just have physical events or they just have X, Y, and Z. We have a very different marketing approach where it's called omni-channel marketing. So while everybody else does direct marketing where they just do one or two channels and you just, that's what you do that. We do
Okay.
6 total channels, which is
Okay.
website, podcast, SMS, email, live events. I missed one, but you get the
Uh-huh.
gist that we're
Uh-huh.
doing everything together. And how
Okay.
it's also different is that you go to these sites, right? So you may go to, not to talk about the competitors, but let me talk a little bit, right? So
Go
not,
ahead.
you may go up to WebMD to go get your information. You may go up to Black Health Matters to go get your information. Where
Mhm.
we're giving you the information, we come to you. And that's
Okay.
how our marketing strategy is a lot different. The thing is with that is that you only kind of go to your phone when you got the headache, right? We
Yep.
can't keep before the headache came.
Yeah.
So we're changing the whole dynamic of that and we're doing it in so many different ways at once. So you're not going to just get the message from our first podcast series with called the Black Health Print. You're going to get it from all these different angles and hopefully it sticks at the end of the day. So that's the goal and how we do it.
Yeah,
Oh,
because
and
I feel
also I'm
like
gonna talk about, I forgot to add something. And then also because we do have a lot of sub brands within it called like Be Healthy, Viva Salud, which are for diverse communities. They have culturally cultivated content. So if you're on our Be Healthy website, you're gonna see like actual articles from Black writers that make sense for Black people compared to just a generic article that's for the whole country, right?
Mhm.
So that's also a big emphasis that we want it to be culturally relevant so we can build the trust, right? You want to see health information from your people. So that's
Yep.
how we're doing it as well too. So yeah.
I love that you're like gonna shoot it out to like so many different platforms, so many different ways, because I feel like everyone gets their media from so many different platforms.
Right.
So it'll be nice to get the information from like the same platforms or what's coming from the same people, iHealth Network, but it's on all
Right.
these different platforms. So I think that makes so much sense. I want to talk about building trust because I think that that's a huge topic when it comes to media and rebuilding that trust between Black and Brown communities and the healthcare research system. Trust is all we continually have to build that. I mean, of course, that's what we do at Diverse Research now. That's what you're going to do. It's always going to be a huge component in our work. So tell me what the role media plays in that, in rebuilding that trust.
Yeah, I think media, crazy enough, I think media plays the biggest role
Okay.
in trust
Okay.
because now we're in 2026 and I'm not saying that like these people are like the best or anything like that, but there's so many different like resources, both pharma, hospital wide, even like with advocacy programs that are out there that like actual like free treatments or clinical trials obviously are considered free treatments too. There are so many like free treatments and say for instance you have like a really like rare ophthalmology disease or something like that, right? There are so many different treatments out there, but if you just have the treatment as the company and you have no way to tell anybody what the treatment is or X, Y, and Z, it means nothing. It literally means nothing. It's great to have. It's like, oh, we have this. You've
So
done nothing
true.
to get the message out.
You
So
got to get the message out.
yeah, obviously media is the only way to do it because it's natural in marketing. So that's what it is. I think media plays the biggest part of it. Media can tell you to like something or to not like something. We see it every
Mm-hmm.
day in the media, right?
Mm-hmm.
That is the biggest thing. It's the biggest player. It's as simple as that. There are so many great things out there. I've been in the industry for years, and also being in the industry as a Black man coming from Inglewood, I've always heard big bad pharma, right? Which it could be true a little
Yep.
bit, but I'm
Shame the
also
devil. No.
yeah, but I've also have been on the other end to see where you could leverage these pharma connections to get treatments X, Y, Z, what it could be. I know that with media, you can actually change the whole perception about certain things and even like talk about early detection. Like I know we're all scared to go get a blood test or something like that, right? But we gotta have these conversations and talk about it. So yeah, media can make you hate them or media can make you love them. So
Mhm.
yeah, it's easily the biggest, I think, factor into all of this.
Yeah, I agree with you. I guess the next question is where is the breakdown? Because, like, what's going on now? Where is the breakdown in communication? Where are the gaps? And we're talking about clinical research and the public health messaging, right? So, like, there's gaps there. And I think that's where your media company is going to come in and
Right.
fit in there. I guess, yeah, go ahead and explain how the communication gaps will be addressed.
Yeah, so there's a few different ways. So I think like with current day media, it's just like, a one size fits all approach We have one commercial. We're going to just broadcast it everywhere. And the
Yeah.
commercial works, it works. It doesn't, it doesn't. And a lot of marketing people do a lot of just check marking compared to like actually like, let's see if we can get the right amount of impressions and conversions rate, right? The reason why we are so different is that while we are a media, engagement platform, cool. We're also a consulting platform too, where any client that does work with us, you're going to get a full consulting measure with us. So, say for instance, like a certain hospital, they're going to work with us and say, hey, we want X, Y, and Z. We're going to sit in a room or a virtual room together, most likely, obviously, but we're going to talk about how we're going to do this, right?
Okay.
I don't want you to just give me your media assets and I just slap them on a page. That usually doesn't work. We want to get high conversions, high impressions to high conversions, right? That's a big part of it. It's just that, a lot of people have done like a one size fits all thing. They check the box off. Okay, cool. I spent the money and got it there. Whatever happens, happens. But we're actually going to be a lot more detailed about how we do our work. And it's culturally, most of our stuff is culturally tailored too. So
Yep.
you got to like kind of be ready for that. So my message to any client that I work with, pharma, hospital wise, if you're not ready to work with me, don't even waste your time speaking to me. If you actually want to get out to these communities, then we can have a conversation. If not, we're not going to do it.
Yeah, you want to work with people who actually do really want to help these communities, these underserved communities, underrepresented communities. Definitely something I have to like keep in mind too as I do my work. And what I hear from when I hear you talking about the work that iHealth Network is doing is you are trying to bring intentionality into the conversation. You are going to sit and intentionally say, okay, what are your goals? How is it going to be best to reach these communities? I think that it makes so much sense to have a tailored message for each community because I am learning every day how different our communities are. Different groups need different things. And that's, of course, that's health equity, right? Like you want to meet people where they are, give them what they need so everyone needs can be met.
100%. And that was the thing too, is that, when I first kind of got into the space, I've done a lot of health equity work within the Black community, but working in that space, and it's also part of my brand too, is figuring out that all these communities is not the same thing. In our community, obviously, it's more of the trust factor, but you go into like the Polynesian community, there's not even trust. It just hasn't been any work done. Simply as that. Like, there's just no work done.
Awareness. I mean,
Yeah,
honestly, Nick, I've found that awareness is really huge in our community too.
right.
A lot of times, again, this keeps coming up in my conversations, the whole fact that our community is just not being asked to be involved in clinical trials, or honestly, that keeps coming up because, and I
Right.
think it might be a bigger issue than this trust issue. The field has always been kind of leaning toward it being a trust issue. But I really think that it's more like awareness and not really knowing how to navigate to get to a clinical trial. And I feel like your media company could help with that because you could put together a campaign that where you can lead the community to how to get involved in research and share why it's valuable and all of that.
Yeah, and then to kind of speak on that point, because I've been in the space for a minute already, for different companies before. But the issue, like on the clinical trial side, right, when we hear like, hey, we're not being asked to be in these trials, right? What I've noticed is that a lot of companies will come to me and have came to me and say, hey, we want to broadcast this clinical trial with you, right? And they come in and say, hey, this trial has enrollment in March, we're going to start in February. And
Okay.
then once the trial's over, we shake hands, you got your payment, cool. We're all like love each other, right? I'm like, that's horrible. Like that's
Oh,
horrible. Simple as that. If you want to like broadcast a trial, right, that starts in, let's say May, you should have been marketing
come
before that,
on.
a year before. And I'm not saying like bring it up the trial, but let them know you're in the community, right? So started with that and just go for a whole year campaign. You don't have to spend a lot of money. I'm not telling you that, but you just show that you just came in to just get some numbers and leave. You need to show they're actually here for this community. That's what they're looking
That's
for. That's what we're
right.
looking for. And
That's
that's
right.
what I've seen has been the biggest issue on my
Yep.
side, obviously. It's just, they say like, hey, we just got to come and go instead of just coming and staying.
Wow. So, yes, education, because you can start there. So, one of the things I continue to say in this field and to the sponsors that I talk to and the people who are interested in working with us is that, yeah, you can't just come into the community and leave. And you can't just come when you need to be there or when you're willing, you want to ask for something, you have to come early and you have to kind of sit and be there and be present understand the community, find out what their needs are, all that, share education with them, feed them, serve them in that space. So then act like you care, a little bit, even if it's an act. Hey, let's do better
Yeah,
with
just
the
act.
acting. You know what I mean?
It's
Even if it's an
okay.
act, like
Listen, I don't need a lot from you. Trust me, I don't.
yeah, even if it's an act, do better with the acting because it's like you have to come early, you have to act like you care for us. And the thing about it is, our communities have been through so much. There's been so much injustices, so many things that have happened to us that we're sensitive, okay? And it's okay that we're sensitive, but we're sensitive for a reason. We're sensitive because of those injustices. And now, hey, we can spot a fake real easy. We know when you're doing something that you really want to do and when you're just doing it to check a box.
Right.
And that's what I'm trying to get across to the field and the people working in the field is that, hey, these are human beings. You know what I mean? We have to do what is going to be best for them and serve them. And yes, get the information out to them just because. And so then when you do have an ask, you've already built that trust. You've already been there. And then they won't look at you sideways when you come through the door.
100%.
You know what I mean? It just is what it is. Okay, I know we just talked about what kind of the experiences you've had with researchers. I think you explained kind of what experience you want to have with these
Right.
companies. Like you want to be able to come in and kind of break down things to help them with their media and reaching their communities. Give me an example or like kind of walk through exactly what your ideal type of partnership with a research company or a sponsor. What does that look like ideally for you?
Yeah, ideally, like a great sponsor is first we talk about like the empathy side, right? Make sure that you're doing this for the right reasons, that you're empathetic with the community, X, Y, and Z. And then I'm gonna go into the consulting piece. Know that we're partners together, right? You may be my client, but it's not as simple like you tell me what to do and I do it. No, we're working together to get this done.
Yep.
And then three, I'm not saying like, I don't want somebody that's like cheap or anything, but like I want, a client that actually understands that we need to do all these things together, not just one or two of these things, that the way that this works is that you need to do everything all in one, right? That's the way this thing works out, right? So it's just client that can understand that we need to like, this is not an easy job to do. You need to work with us. It's going to work out for you at the end of the day, but this is not like working with iHealth Network is not a checkbox.
Yeah.
You want a checkbox, go somewhere else. But
yeah.
if you actually want to work, you need to roll your sleeves, let's work with us. And that's that's what we're looking for, people that can like work hard with us.
Yeah. And so how long would you suggest a company working with iHealth Network in that space? Is it something where they bring you on as like their media platform, period? Like this is who we come to for media for the life of our organization? Or can you do it as a project-based type thing where you're coming to just for a certain project and working with us? And if it is project-based, what ideally, how long to make an impact? How long should that project be that you're working with me?
There's so many different ways that you can work with us. If it's the clinical trial side, if it's the product on the market side, if it's a advocacy kind of project or something like that, right? I would say that it is really possible to work with us and do mostly all your marketing with us because we have so many different channels that you can market with, except TV. So realistically, you can honestly give us a portion of your budget and then give the rest to TV or whatever the case, printing billboards or something like that, right? But I would not suggest using us for everything. I would not suggest that at all. I think the best way is always to be diverse within, your budgeting and all that. But realistically, because we do monopolize a lot of current day media, if you really wanted to, you could. I would always suggest, work with other people too. What if we don't work with, right? Still work with TV, still try other media outlets. That's cool. But really, you could, but I would never say anybody works just with us, honestly.
Yeah, I guess I was more so thinking like one of the challenges that we have is that we have projects that come to us and we have 6 months to work on it. Like we have a 6-month project where we have events in the community. We have our safe space is available and our study buddies available while we're in that 6-month period. But then after that 6 month period, it goes away because now the project is done. We don't have funding anymore. Is that kind of how it could be for the media work? I mean, where you have a 6 month project and you push out this media, but then it goes away. That is very challenging for me because I always say, like, wow, how am I going to keep building trust in the community if it goes away? If after 6 months it goes away?
Right. And that part is really challenging because you can do this 6 month project and imagine your next project's not till like a year from now, right? And then we
Yeah.
just like gone stagnant. There's certain things that we can work with to just, still keep the name going, obviously, at
I
very
think,
minimum. That's the thing too, like any client I work with, I don't want to just say like, all right, you need to do 1 million marketing points every month with me. No, I'm saying like, okay, like when you're in a serious time, we can do a lot more. But when there's nothing really going on, just, we can
right.
minimize the of just let's just hear your name a little bit. That's all
Take
we
it
want to do.
down. Uh-huh.
And we can
Okay.
take it down a lot, honestly. But we just need to hear your name a few times throughout the week. That's cool, but we don't have to do as much, honestly.
Yeah.
Yeah,
I
that was
like that. I like that. I like that because that's something that in those times for diverse research now, what we do is even if we're not working with the partner anymore, now we actually have a whole community of people that say if it was a lupus project, now we have a whole community of people that have lupus that still need us.
right.
And so what we have done is they actually come into our family and we actually still engage with them. Even if we don't have a project, we're still telling them about the things that we're doing and we're still inviting them to certain things. We're still offering to find them a study if they need it.
Right.
So I agree with you. It's something has to be set up in a way. Well, the work has to be set up in a way where you're not just leaving the community after these projects are over. I mean, yeah, that's going to be a part of the trust building.
Right. And that's beautiful. Yeah, maybe help them find other trials, something.
Yeah.
But yeah, that is just like beautiful in itself, honestly. So yeah.
Okay.
Yeah.
So tell me, in 5 to 10 years, Nick, what does the impact look like for your brand? What do you want to see? Like 5 to 10 years, what are you seeing? The goal.
Yeah, more people of color in hospitals and clinical trials. Well, in hospitals, as in like getting early access to treatments and all that, but outside of like hospital beds, right? And then I will quit as soon as this happens. But once I find out that life expectancy gap closes,
Yes.
quit the next day. So that's what we're gonna do. We're gonna take over, and then we're gonna take over all of healthcare marketing. I believe. I think we have the strongest platform to date, and yeah, that's the other side of it. But my real currency for me is the work done, the impact. I've been asked this obviously because we're an investor. I think are both in investor rounds, obviously, but
Uh-huh.
they asked me, what's your currency? What's your business model? I said, if somebody comes up to me and tells me that iHealth Network saved their life, I'm good to go.
Come
I just need one of
on.
those. I just need one of those, and I'll be good to go.
I
Everything
love
else is
it.
extra. So
Yes.
go on.
Yes, I agree with you. We connect because of that, because we both just want to bring better health to our community. That's what it's all about for me. It's what it's all about for you. So, yeah, thank you so much, Nick. I appreciate you being here. If you all want to work with Nick, we will have his information in the notes of this episode. And yeah, we so appreciate you, and we can't wait to see iHealth Network out there blasted out.
Thank you, Dr. Ren. Yeah, I'm excited. It's been a lot of work, but I'm excited myself. Thank you for showcasing us. This is awesome.
Of course. All right. Take care.